It all happens here in New York City. Home to some of America's best hospitals. Places off limits to cameras. God damn it.
We are at the front lines of some of the busiest hospitals in New York, where the fight to save lives comes case by case. New York Presbyterian University Hospital's emergency room sees over 230,000 cases every year, and tonight we bring you an inside look. Paramedics arrive via ambulance to the emergency room already with a thorough knowledge of the patient's chief complaint, condition and history. Disclosing information, such as allergies and medications, can prevent further complications, such as systemic reactions or anaphylactic shock during treatment. This information is then communicated to the healthcare professionals in the emergency department upon arrival. With consent of treatment, the doctors and nurses have the right to treat them. In an emergency situation, implied consent allows care to be provided until the patient is awake and able to consent. The symptomatology of a patient helps determine immediate diagnoses of potential disease or condition. New York Presbyterian sees cases that vary from acute to chronic symptoms. In severe trauma cases, these symptoms and signs may become exacerbated. The attending physicians and nurses are primary healthcare professionals in the emergency department and work in conjunction with technologists, technicians, and surgeons. It's early afternoon at New York Presbyterian, and the emergency department is already in full swing. A 15-year-old female is brought in by her parents with an acute aching pain in her right lower quadrant. She has nausea and vomiting, along with a low-grade fever, and is severely tender to palpation. After an H&P, Dr. Emily Levine immediately orders a blood test, urine test, and a computerized tomography scan to confirm her suspicion of appendicitis. Awaiting his chest X-ray and CT scan results, 50-year-old Sam Teller was transported to the emergency room with chief complaints of dyspnea, severe cough with mucus and fatigue. This is not Sam's first visit to the emergency room with respiratory distress, and from past chest X-rays he knows he has abnormal lung tissue and inflamed airways. Dr. Pat Miller, chief pulmonologist at New York Presbyterian, discovers faint breath sounds bilaterally with mild rales through auscultation. Diagnosis for Sam is chronic obstructive pulmonary disease, and with no cure, Sam must now start a regimen of a bronchodilator inhaler, antibiotics, and oxygen therapy. 4 weeks after being brought into the emergency room, Phil Cook meets with cardiothoracic surgeon, Dr. Adam Stein, to discuss surgery. Dr. Stein discovered Phil's mitral valve was leaking in an echocardiograph, and will need to be repaired. Dr. Stein schedules Phil for a valve replacement using a xenograft for the following day.
This is going to have to be taken care of. This valve is torn, and it's not quite coming together. This is going like this instead of like this.
All non-ambulatory patients coming through the emergency department will at some point have a venipuncture procedure done by either a nurse or phlebotomist. The most common diagnostic blood tests ordered are complete blood count with differential, blood smear, and blood chemistries. These tests can help diagnose many conditions, disorders and blood diseases. Early evening, endocrinologist, Dr. Hales presented with a 35-year-old female with supraventricular tachycardia, palpitations, hypersensitivity, exophthalmos, nausea, and abdominal pains. Laboratory findings shows elevated T3 and T4, with low levels of TSH. With the sudden onset of severe hyperthyroidism, Dr. Hale moves quickly with drug therapy to suppress further production of thyroid hormones. The patient will remain in the hospital for further observation, but Dr. Hale feels a thyroidectomy is likely. 7 p.m. 37-year-old Sarah comes in complaining of chronic headaches that have become so severe she's suffering from blurred vision. Dr. Michaels performs a neurological examination and sends Sarah for an MRI of her brain. Results are not so good: a large, possibly malignant brain tumor that will require an excisional biopsy.
This one goes so far front to back, you have to dig a tunnel to get into the tumor and leave the working brain. It's challenging.
Many emergency room visits by young athletes require the specialization of orthopedic residents for further exam. In this instance, a 22-year-old male athlete arrives from a baseball game with an open fracture of the distal radius, and has had chronic aching in the synovial joint of his right shoulder while pitching. As explained by orthopedists,
Radius fracture is a fracture that occurs right around the wrist joint of the big bone on the thumb side of the wrist. Lots of mechanisms can cause it, but the most common mechanism that we see is a fall onto an outstretched hand.
While the orthopedic resident feels these are two separate issues, an X-ray will confirm the open fracture, and an MRI confirms cerebral avulsion. New York Presbyterian's emergency medicine provides 24-hour expert care to thousands of patients annually. Cases vary from infectious diseases, gastrointestinal bleeding, to lacerations and rheumatologic complaints. These top facilities provide a level of health care to all that come through their doors.
Next week on New York Med.
He got intoxicated during the St. Patrick's Day festivities.
You have head trauma.